going to make a note. They were awakened to my voice. They were already awake and alert. I'm going to ask them to grip my 2 fingers so I can feel whether their grips are equal. And then I'm going to ask them to move all their joints so I can know that they're all able to be moved. Then I'm going to do my JOMAX, which is judgment. It's what kind, seems like it's a pretty sunny day today. What kind of coat would you wear? You know, see if they know whether it's raincoat or no coat at all, or that's just a good way. You can ask any judgment question you want. Orientation we already did, so you don't have to do it again. Memory, that's when I say I'm going to ask you to remember the 3 things, the cap, the pen, and the sweater.
Quick question. What was the level of responsiveness? What was that?
Are they in a coma?
Okay.
Did they awake to my voice? Did they have to be awoken to touch or deep pain? Or were they already awake?
Deep pain, is that when you rub their clavicle?
No, you rub their sternum.
That's deep pain.
Mm-hmm. Trust me, it's deep pain.
They do the sternum rub. They tell us we do if someone's not responsive. They do a sternum rub to see if it kind of get them going.
Mm-hmm. Okay.
3, 4, and
then
6.
you do the 3 things that you're going to remember. Then you ask them if they can remember, depending on their age. For you guys, I would say, well, who was the president in the year 2000? Can you remember that? Of course, it's going to take you a little while to think. It's going to take me a little while to think. But you were at least alive 12 years ago, and you'll be able to figure it out.
Bush.
For them, you might say, if it's an older person, you might say, who was the president in 1962? Well, they would know, if they had a good long-term memory, that that was John Kennedy before he was shot. Okay. Then you want to ask about their affect. Affect is, are they anxious? Are they happy? Are they sad? You know.
You ask them that, or you just observe it?
No, you observe it and make a note.
So is that
If they're blunted, I have no emotion. I'm just answering your question. That's more a schizophrenic type sign.
So that's mood. Would you
That's
call it?
affect. No, just trust me. Go with affect. Affect is how you present yourself. I can present myself happy and still not be in a happy mood. Okay. Level of consciousness is, once again, awake, alert, oriented. That's kind of the same thing as level of responsiveness. So you really don't have to do that again if you did it before. And then their speech. Are they slurring their speech? Are they forgetting words? Or substituting incorrect words for the right words? Could be side of a stroke. Are they tangential thinking? Remember, that's the Bing.com commercial?
Tangential. When they go off on a tangent and one thing leads to another, but it doesn't really stay on track with what you're talking about.
They'd be like, apples, apple pie.
Those are funny.
Apple orchard. I've seen apples on a tree.
Correct.
My mother.
Apple with my eye.
My mother's last name was Apple.
Did you know Apple Computer?
So then you go with the cranial nerves, olfactory, open up alcohol. Can you smell that? Optic. Which way are my fingers pointing? It's even better if you can use one of those cards in the box, which we will have, step about 10 feet away and ask them the smallest line they can read. You've already done the 3, 4, and 6. Those are the cardinal gazes. Then you do 5, trigeminal. Clench the teeth and see if you can feel their muscles, because you're actually feeling the muscles. Okay? Then you want to do a facial. Can I see you smile? Can I see you frown? I'm not very good at frowning. Acoustic. Cover their ear and then go. Can you hear that? Can you hear that? Then I would take the, you want to hand me that? You want to take the tuning fork. Who is this? Is this Rodney? Okay. You only want to hold it down here. If you hold it up here, it makes it move. You want to see if they can hear it. This is the Weber test. The bone conducts sound. If they can hear it, then their bone is conducting sound appropriately. The Rhine test you're going to put it on this bone right behind the ear.
That's
Wanna
the
be able to hear it?
process.
And normally, but you don't have to do it, but you would have your partner say, "What? Tell me when you can't hear it anymore." When that sound goes away, then you go, "Can you still hear it?" And it should be louder, you can hear it again, because air conducts sound better than bone.
This is for the acoustic.
That's it for the acoustic. Glossopharyngeal is, what did I forgot again? I'll come back to that, I'm sorry. Oh, swallowing, glossopharyngeal, ask them to swallow. And then for vagus, you're gonna tell them to go, ah, watch the uvula, see if it moves. It could be mean and make them gag, but you
You
don't
mean
have to.
open, you want to have them to open their mouths so you can see it?
And the little hanging thing is supposed to move?
Uvula. Okay, then you want to see the spinal accessory, and I would do the whole, okay, push up on my shoulders, okay, or press against my hand. No, the other way. And then the other way. Okay, there you go. And then, hypoglossal is tongue balls. Then I would do the balance. Okay?
Do you do both?
Farad, you
Sorry.
don't have to, I'm not very good with this side, so I usually don't demonstrate it,
You
but
mean
Farad was
Paul?
making them hold, no,
Oh,
Farad was.
Farad.
Making them hold their ears, I'm like, are you auditioning for the circus or what? That's kind of neat. No, you just have to put your arms out. Then Romberg, close your eyes and see if they sway. You could also, if you want, check for pronation. That's, a lot of times when they stand there, they slowly bring their hands back around.
What's this part
Okay.
called? Balance.
Cardiac, if you remember 8